I remember like yesterday, a very fateful day when I was at a mayor's press conference on March 9th. My cell phone text started going off that the first 3 cases in the state of Ohio were indeed at university hospitals. And I got to tell you, that was a real gut punch.
This has been a really difficult year, and everyone has been impacted by the pandemic. Everyone has experienced loss and pain.
Obviously, we know now that it was in Europe, shortly after it was first identified in China, and we got infected on both coasts.
The entire Cleveland community was needy at the moment because they were afraid. They didn't know what was going to happen. We didn't know the lethality of this virus. We didn't know the communicability of this virus.
I remember personally being extremely uncertain about the future.
This was a rapidly changing environment. We were very transparent with people. We told them what we knew, and most importantly, we told them what we didn't know.
We wanted to be able to let the community see that we're going to take care of them, we're going to educate them, we're going to give them the tools they need to be safe.
It certainly appeared as if we in Cleveland fared better than those in other communities. I suspect some of that has to do with the luck, but I suspect more of that has to do with the fact that we have these 3 institutions in our town, and they were dedicated towards protecting and preserving our health.
I mean, that's the thing with the pandemic, right? You can't just be one person or one health system or one community over there and fend off a pandemic. If we don't all work together, truthfully, the suffering is raised for all of us.
The year of pandemic was the year of unprecedented collaboration among healthcare organizations in Northeast Ohio.
The extent of this has never been seen in modern times. We knew we had to come together.
Every health system stepped forward and made themselves accessible in ways that the community had never before experienced. They provided a model of collaboration, of how if we leverage each other's resources and work together, we can emerge strong through this pandemic.
It started with the simple phone calls and turned out into coordinated effort by hundreds and hundreds of healthcare providers.
We were learning about how to care for patients. We were trying to make sure that we all had the best evidence-based therapy, how to approach things.
What are you seeing? How many patients do you have? What do you need?
They didn't see their responsibility and their job to the community as stopping at the real estate door where their institutions are located.
Religious and ethnic beliefs are going to become a concern for people, and we needed to be able to tackle them head on. So we made sure that we went out to the African American communities for testing. When they didn't have access, the Latino community, we dealt with the Orthodox Jewish community. So we wanted to make sure that everyone had equal access.
We would call on the doctors to help educate our community. We knew that we were calling them while they were in the midst of sleepless nights. But every time we called on these 3 institutions, they said, "Here I am. How can I help? What can I do?"
People worked extra shifts. Janitorial staff, cafeteria staff, doctors, nurses, respiratory therapists, who on their time off wanted to come back to the hospital to relieve their workers. That totality of dedication, selfless dedication that I witnessed is something that will go down as one of our finest hours.
These 3 organizations have all ensured that vaccines are readily available in Northeast Ohio. So we have a community of people in Northeast Ohio who can access the vaccines and allow us to move past the pandemic.
Our mobile response team was able to go out with partnership from Cleveland Public Health and Cuyahoga Public Health to provide vaccinations for the homeless. One of the providers texted me at the end of the day that it was the best day she'd ever had. And I think that joy of being present and being able to provide safety and security for our community is really why we're all here, right?
It's not the clinical care, the very proficient clinical care that was delivered. It is the kindness by which they treated people and they treated each other.
I want to thank the 3 institutions, the Cleveland Clinic, university hospitals, and MetroHealth for the work that you've done this past year during the pandemic. It has been greatly appreciated by our entire community, and we could not have gotten through this without you.
Words cannot properly express the appreciation that I personally have for what the hospital systems have done during this pandemic. And I speak for myself and thousands of other people that I know who wish they could also thank you personally.
Each one of them would deserve it on their own, but we are really blessed to have all three serving our community, and it's really an honor to be able to recognize all three. So again, thank you very much.
Thank you for everything that you've done to keep our community in Northeast Ohio safe. And Mazel Tov on receiving this high honor.
This is perhaps one of the best examples of Cleveland teamwork. And I want to thank the Jewish Federation for including all of our hospitals that are recognized here today for the work that they did and they continue to do. So thank you very much.